Well, today on the show, we're in Biloxi at the Back and Neck Care Center with Dr. Vincent Mitchell, who is going to talk to us today about something that a lot of people deal with, especially diabetics, and that's neuropathy. How are you doing?
Hey, Jim. Hi.
Good to see you.
Welcome.
I'm doing fine. Thank you very much. Now, you're known as the Back and Neck Care Center, but also the Gulf Coast Knee Pain and Neuropathy Center. Do you talk about neuropathy and some of the things that people deal with that?
Okay. Well, I welcome you here first and appreciate you coming in. Neuropathy, you really got to understand the definition of neuropathy before we can treat it. Neuropathy is just simply a dysfunction of the nerve or disease of the nerves. Mm-hmm. Now, there's different types of neuropathy, and what we've seen with these patients that come into our office, and the reason why we're seeing a multitude of these people coming in lately is because the diabetic population is just getting pretty much an epidemic.
Well, Mississippi's number one in type 2 diabetes.
Yes, sir. And so the latest statistic is that about 100,000 people now, they're saying it's pre-diabetic or diabetic, either type 1 or type 2. So what we have found is that these patients are going the medical route, which is fine, but they're being told there's nothing else they can do as far as being put on medications. That's really all they can do.
Right.
Okay, so when they go to the medical doctor, is that they're told to get on gabapentin, Neurontin, Lyrica, which it'll help with some of the symptoms, but the problem with that, Jim, is that those type of drugs, those drugs are anti-seizure medications. And what happens is that it slows the brain activity from your brain down to your feet. And so it actually eliminates some of the pain, or it'll help decrease some of the discomfort.
Right.
But it causes the patients to start having balance problems sooner.
Really?
Yep.
Well, I mean, so if it affects the feet, then I guess over a period of time, their feet swell, the circulation is bad, and it just turns into a worse situation than what they had to begin with. Yeah.
What you'll find is that when they take this medicine, is that they'll have to take more. And I gotta stress this to you and anybody else who's watching, is that peripheral neuropathy is a progressive degenerative disease. There is no cure for that. Okay?
Really?
Yes, there's no cure.
So once you're diagnosed with it, that's it?
You have it, but the NIH, which is the National Institute of Health, which has been around since 1887, they do a lot of our medical research in this country, and they have found is that if you catch it in time, with this neuropathy, you can help regrow or help regenerate some of the nerve fibers and start getting more blood around that nerve to regenerate it. But you gotta catch it in time. That's why I implore patients who come into my office is that we gotta catch it in time. So anytime we do a dinner talk, a lunch talk, those are things that I have to stress to them, because if you don't catch it in time, you'll start off with a walker, and I always say this, you'll start off with a cane, then a walker, and then you'll end up in a wheelchair.
And that's because you just can't walk anymore.
Eventually, it'll get to the point where they just will not be able to be ambulatory.
So what are some of the symptoms? Let's look at what are some of the symptoms that, I mean, can people with pre-diabetes, can they have it?
Yeah, there's several ways you can get neuropathy. You just don't have to be a diabetic to get neuropathy.
Really?
Yeah.
Most people kind of think that if you're diabetic, you're going to end up with neuropathy. I would think that
most often you do.
Okay, but if you're not diabetic, you can get it.
Yeah.
Well, what would cause something like that?
Medication interaction, autoimmune diseases. You can have trauma. There's alcoholism. Okay.
Wow.
Thyroid problems. A multitude of things can cause what they call peripheral neuropathy. And you have peripheral neuropathy means it's outside the body. It's outside the nervous system. So it's your fingers, your arms, your legs, your toes, and so that's why they call it peripheral neuropathy. And so there's really no, I guess the only treatment they have is for medications.
Right.
And a lot of times they'll do what they call a nerve conduction velocity test. These radiologists will do that, or neurologists will do this. And what that does is just simply they put needles in you and light it up with electricity to find out how your nerves are transmitting.
That doesn't sound fun.
No, it's painful. It's painful.
I'm sure.
Yeah. So, but there's really nothing else they can do other than the medicine route. And that's why our program, we've got to qualify patients, and I have to really stress this too when I do any kind of talks, is that we don't accept everybody. That's the thing. You have to qualify for care in this office. We turn people away because their diabetes or their neuropathy is too far gone. And if it's too far gone, there's nothing, I'm not even going to waste their time treating it.
Exactly.
So.
Exactly. Well, I don't want to say that's a good thing, but I guess it saves time and money for them.
Yeah.
Because as you said, make them as comfortable as they can. But
yep.
is there a point that you can start treating them with the hopes that you can stop it?
That's what we hope to do. Yeah, we've got many patients that have come in our office through the several years of doing this. Is that when they come in and they start a program, we will know for sure that we can treat them. This because we do a couple tests on them to see if they're a candidate in this office. They have to be a candidate. We have to rule them in or rule them out for care in this office.
Right.
And once we can get their arms wrapped around it and slow the progression, we can help regenerate some of those nerves and help regrow some of that fibers, the blood into that. Because you got to have two things for this. You got to have fuel, which you got to really kind of watch your carbohydrate and your sugars. So if you're a diabetic, they all know about doing that.
Can't do that, yeah.
Can't do that. And number two, you got to activate that nerve. You got to activate it. You have to get oxygen to the body. You got to get your ATP, which is adenotriphosphate. You've got to do several things, and that's where a lot of our treatment program does that with cold laser, back on track, PEMF. Those are all the things that we do in this office.
I was going to ask you, what are some of the treatments that you do to get this back on track?
Well, you mentioned back on track, and that's one of the tables here. Is that simply? I think you even got on it.
Yeah, I got on this back on track table here when I came by to visit them and everything. And that's awesome.
Yeah, and that's one of the things that we do because what we have found is that any patient that they have neuropathy, is that you always got to look at the lower back because of either degenerative arthritic changes, stenosing, arthritic changes. Those are things that we have to look at to open up that disc to get the pressure off that nerve that goes to feed those legs and those feet.
So a lot of it has to do with the spine whenever you've got those nerves because everything just kind of centers through there.
That is part of the
from to every part of the body into the brain.
That is part of the problem. Yes, sir.
Wow.
Yeah.
So these are, again, it's one of the things, and y'all have a few different treatments that you use to work with them.
Yeah, we have many other things in here that we haven't talked about. But I do want to stress to you, for your listeners, that anybody's watching, is that when we have patients that do call our office or they hear me talk through a lunch or to a dinner, is that number one, we have to qualify them, and we do that by they can call the office, and there's for $60 they can come in and we can actually qualify them. We'll do a test on them, and if we cannot help them, they'll get their $60 back. So we have to rule them in and rule them out with care in our office.
And he did mention that they do workshops different times. As a matter of fact, you can go to their website or your Facebook page and find out exactly when they are and where they are here along the Gulf Coast. They do those different times during the week.
Yep.
Thank you so much, Dr.
Jim,
Mitchell.
I appreciate your help. Thanks for coming
Can't wait
in.
to see you again.
Me
So
too. Thank
if
you.
you if you like some more information about that, if you or a loved one is having to deal with early signs of neuropathy, again, find out if you're a candidate. Call the number, make an appointment. They're located on Pass Road in Biloxi, just east of Keesler Federal.